Okay, so video number 2, swabs and specimens. So you're probably loving my shaky camera by now. So I will start with what I'm going to talk about in this video is how to process the different types of swabs that you'll see in a clinic and how to prepare and process those swabs. So the first thing I'm going to start with, don't forget your gloves, always remember your gloves, is how to, if we had to send your urine analysis that we just talked about, your physician has asked you to send that either for a micro, macro, or a culture. So I have my little sample here in my little sterile pink top container. So these are used not just for collecting urine samples, they are also used for collecting C. diff, sputum samples if your lab does, if your doctor's office does that. But for the purpose of this exercise, we're going to talk about what to do with these if there is urine in them. So these, once before they're open, they are considered sterile. All urines, if you're sending them to the lab, must remain in the fridge. So most medical offices will have a lab pickup, typically usually in the morning, daily. So if you were to collect a sample in the morning before that lab pickup, you could certainly keep it in this container in the fridge until the lab comes and picks it up. If after that time you still have to send that out, but your lab pickup has already come, you're going to need to actually store this for routine culture in a different container. So what's called an overnight container that is filled with a preservative, and so that keeps this sample from growing any bacteria. Of course, this also remains in the fridge overnight, so all urine should go to the lab immediately within 24 hours. So if your doctor instructs you to send it for a microscopic urine or a macroscopic urine, it cannot be in this overnight container. They cannot process that with the preservative, so it must remain in this one. If your sample's going out to the lab right away, that's fine. It can be transported through your courier, but if it's an afternoon collection, typically the physician would ask that the patient take this right away down to the lab because it cannot be in our overnight container. Anything that you send, whether swabs, specimens, urine, always must be affixated with a patient label, patient demographics, and must have accompanying lab requisition. So depending on what it is that you're ordering, you would use the appropriate lab requisition. Your physician would fill this out indicating the testing that they were required. This also must have patient identifiers. So if you are doing this, be careful. Always pay attention. Make sure that you have the correct label not only on the specimen, but it must match the patient's name on the requisition. So always do care. Okay, so say I needed to send this for just a routine culture and it was past my lab time. These little containers that we have now, we used to have ones that were very similar to this one. They were a white top and they had the preservative in the bottom, but now we have like these little, they have a little lancet. So I'm trying to, hopefully I can show you. So what I'm going to do is I'm actually going to put this upside down. So my little pointer end here, my little end here is going to go into my container. So like this, I'm just going to, I want to push this down so the lancet will puncture my, the little rubber part here, and this will fill this vial up with that sample. So I'm going to puncture it. Kind of hard to see. This is just water, so if it gets all over me, that's okay. So I just give that a little press there. And I don't know if you can see, but it is now pulled that water into this sample. It is sealed, so it's all good. So this would have obviously a patient label on it, and it must accompany a laboratory requisition. So usually when we're transporting something like this, I would put it in a biohazard bag. The sample would actually go in the inside, and there's a little pouch on the outside for your requisitions, and this would go in the fridge. So If you were just sending it in the morning for a routine culture, you could certainly just put a label right here in the fridge with the appropriate laboratory requisition. And again, in one of these little biohazard bags. Most offices have these. Okay, so that is how you process a urine sample. So now we get on to swabs. So we have what is called a Copan swab. It is a red top, and these are used for swabbing things like superficial deep wounds, vaginal cultures, looking for bacterial infections. So if we were using this strep throat swab, looking for a bacterial infection in the throat, vaginal swabs, looking for bacterial vaginosis, vaginitis. So it's got a little gel here. So once the wound or area has been swabbed, I'll show you how we process that. So your physician would open that up. They would remove this little lid. They would swab the area, and the swab would go back into the container, securing the lid and assuring again that your sample had a patient label affixated with their information. If your doctor is to write anything on here indicating what type of wound it was, I would never cover up that writing with my label. I would just try and move that label so none of the physician's writing was covered up. So again, this would have a patient label with the appropriate requisition indicating what the test was, whether it was a throat swab, if it was a superficial or a deep wound. Things like standard skin wound isn't usually suffice. It has to be very specific. And I would indicate on here if there was a site. This would get, these are usually okay. They must get sent to the lab within 24 hours. It's not wrong to not refrigerate it. We refrigerate it overnight if it's before our morning pickup. It doesn't harm it to put it in the fridge, but this also can be kept at room temperature, but it must be sent to the lab within 24 hours. So this is our bacterial swab. Things like eye infections, bacterial vaginal infections, wound infections, red top Copan swab. Okay, so another type of swab that you will see, this is called an Aptima swab. And we usually use Aptima swabs for, it's a unisex, so it's male or female. If we were using it on a female, it would be a cervix swab. It could be a urethral swab for male. And what we're testing for with these, chlamydia, gonorrhea, and trichomonas. So it's considered a white label. There are at-home swabs for females. So this would be a cervix. I'll show you the at-home one for vaginal. So this is considered white label. So your physician would swab the area. If you were assisting a male on a PAP, he may do this swab. You may be asked to hold it. So your physician would swab the area. You would insert it in here and break it off. And then that lid goes on tightly. And again, a patient label would be affixated to this, and it would accompany a proper laboratory requisition. This also is okay at room temperature, but if it's overnight, I usually put these in the fridge. So this is a urethral swab or a cervix swab for chlamydia, gonorrhea, and trichomonas. If your physician wanted to test a male for chlamydia, urine chlamydia, gonorrhea, they often probably don't use this swab so much. Slightly invasive. They probably just send the patient to the laboratory for a urine sample. So we have our Aptima swabs, our Copan swabs. There is sort of a slight variation to that Aptima swab. This is considered an orange label, and a female could take this at home and do a vaginal swab, again testing for chlamydia, gonorrhea, and trichomonas. If they did, this is also what we're using currently. That leads me to my third. Is what we're using right now. Due to COVID, there's a bit of a shortage. We had other swabs. They were called the blue top. These we're using currently for viral swabs, and that is for checking things like herpes simplex virus, so any viral infections. Physician, very much similar to the Optima swab on how it's swabbed and collected. It again must have a patient label, an appropriate laboratory requisition, and I would put it in one of these biohazard bags with the appropriate lab. So whenever you're filling out a lab, make sure that you have the patient's name, demographics, ordering physician, the test indicated, any copies too, and your requisition is signed by your physician. Okay. So then I have a couple more here to go. I have a fungal culture kit. It's called a Myco Pack, and this is taking swabs of skin, hair, and nail, checking for fungal infections. Your physician would process this sample according to the instructions. As an MOA, what you need to ensure is that there is a label on here. It does not need an internal label. Your physician will collect that sample. Let's see if I can pull that out for you. It gets swabbed, and the little samples get kind of tucked in this little pouch. Put back in this other pouch here, sealed. Must have a patient label here on the front, and accompanied with a laboratory requisition. And these do not need to go in the fridge. They must be transported immediately to the lab, but they're also okay at room temperature. So really, if these go in the fridge overnight, does not do them any harm, but they are okay at room temperature. Urines must always be stored in the fridge for transport. So my last little one is if we were to do a lesion removal and we were sending something for pathology, we use these little containers here, and they have like a formaldehyde type preservative in them. So your physician would collect, remove it, whether it be a punch biopsy or surgically remove it. They would put their little sample in here, and of course this must have a patient label on it, and it would go with an anatomical pathology requisition. These do not need to go in the fridge. I never put these in the fridge. Should be transported within 24 hours to the lab. They do not need to be refrigerated. But again, accuracy is very important to ensure that you have the correct label on here, and that label always matches the accompanied requisition. So I think that's it about swabs and specimens. So hopefully this video turned out